In this practice, I'd like to introduce you to a version of the body scan. So I'm only going to be doing this for 10 minutes, so it's going to feel quite different than the standard longer body scan practices that you might be more familiar with. But I'm just going to use this as an introduction, and then you might want to seek out longer body scan practices. So usually when we invite people to do a body scan practice, this would be lying down, perhaps on a mat or even a mattress, something where your body can be supported and then perhaps covered in a blanket as well, just to make sure that you are warm enough. Sometimes though, for people lying down, that can be particularly uncomfortable for their lower back, in which case often people might bend their knees and have their feet flat on the floor, just to kind of take that pressure of the lower back, or they might even place a cushion underneath their knees to kind of help take some of that pressure off. Other people choose to do the body scan sitting up, which then avoids any kind of pain that might be associated with lying down. So this is kind of really an invitation as well to have a practice, experiment around different postures that might be suitable for doing a body scan practice. I'm going to lead one sat down, so that you can choose to do this if you wish, and then there will be other opportunities for you to practice doing the same kind of exercise, but we're in a lowering down posture. So feeling free to choose whichever posture suits you best. So as we have done in the other practices, I'm just going to invite you just to adopt the sitting posture. So again, remembering our key elements of our feet flat on the floor, awareness of the backs of the leg on the chair, and then this sense of the lower back and the spine rising up. So we're holding our body, kind of honoring our body really in some way. If you choose to do the practice kind of lying down, then as I said, on a yoga mat or a mattress, and then just taking care of if you experience any kind of lower back pain, about the changing of the posture. So again, the invitation will be to close your eyes, and again, just noticing for yourself if this feels appropriate for you or not. And if not, you're also always free to open your eyes to do this too. So as we come to this practice, again, just round about a 10-minute practice, so quite a quick body scan practice. Just again, see if you can follow my directions as best you can. So when you're ready, just choosing to close the eyes or lower your eyes down like this, just while you kind of get settled, and then I will begin my instructions. So just coming into the body scan practice, taking a few moments just to settle the body in whichever posture that you have chosen. So if you are lying down, just kind of spending a few moments to kind of shift the body, just being aware if you need any extra care taken with your lower back, bending the knees, having your feet flat on the floor if that feels comfortable, or if you're sat in a chair, just really tuning in just for a couple of moments, feet flat on the floor, legs uncrossed, sense of the back of the legs on the chair, and the lower back and the spine rising up, stretching up, the neck and the head just resting on top. Just bringing that awareness to the whole of the body as it's sat here. And just noticing those points of contact with the floor beneath you. So if you're lying down, that might be the heels, and then parts of the backs of the leg, the bum, parts of the back and shoulders, parts of your arms, the back of the head. If you're sat on the chair, just noticing the feet on the floor, backs of the leg and the bum on the chair. And just inviting attention now, sort of down the torso, down the body, into the legs. The awareness here of the left leg and the right leg together. And bringing just that awareness to whatever sensations might be present. So whatever that might be, An awareness of pressure or weight. Might be a sense of temperature, tingling, pulsing, numbness. So just being open to whatever the experience is right now. Noticing how things are in the feet, the ankles, the lower legs, and the upper legs. And then on the next out breath, just letting go of the awareness of the legs themselves and just moving our attention up to the sit bones, sort of the hips, the pelvis area. And then further up into the lower abdomen area, the kind of belly and the stomach. And the ribs and the chest. Might be aware of the way in which the body gently shifts and moves with the in-breath and the out-breath. And moving our attention around to the back of the torso, so perhaps the shoulder blades, the back and the lower back, the ribs, all the way down the spine, back down to our pelvis. We have this sense of holding the whole of the torso in awareness at one time. Just noticing whatever's here to be noticed. You might be aware that our mind really starts to wander, getting distracted. Invite an awareness to what that might be. So worry, daydream, sleepy, planning, rushed, and then come back to the body. And on the next out breath, just letting go the awareness of the torso. Moving our attention now to the awareness of the arms. Now the shoulder, connecting to the shoulder joint. The upper arms, the elbows, the lower arms. What's here to be noticed? And then into the hands themselves, just perhaps bringing an awareness to the way in which the hands feel, either next to the body or on the body. How the skin stretches over the fingers. Awareness of the palm, perhaps a change in temperature or moisture here. Noticing any sensations of heat or temperature. And then into the fingertips and the thumb tips themselves. What does this feel like? What is this sense here? Pulsing or tingling? Just bringing awareness to all the sensations that are present. And then on the next out breath, just letting go of the awareness of the arms and the hands, and we can move our attention up now to the neck and the head. You might notice that certain parts of the body hold some tension for us, so just really tuning in and noticing if that's there for you. Following the top of the neck onto the skull, Just following around the back of the head towards the crown of the head, and then down to the forehead, and perhaps just pausing here, just noticing if there's a sense of a frown. And if there is that for you, we might choose to deliberately breathe into that frown, helping us really explore what's going on, and then on the out breath, just softening, just opening around it. And then down into the eyes and the eyebrows, and then into the nose, and the cheeks, and the cheekbones, outwards to the ears, to the outside of the ears and the inside of the ears, to the jaw and the chin, around to the front towards the lips, the tongue, inside of the mouth, teeth. And then just zooming out a little bit to hold the whole of the face and the head in awareness at one time. Almost breathing into it, filling that whole space full of the breath. And then widening once more the zoom lens as we bring awareness to the whole of the body as it's sat here or lying here today. And each time we breathe in, breathing into the edges of the body. And as we breathe out, just softening, opening around it. And then as we come just to the end of this brief practice, just taking some time, gently opening the eyes if they've been shut. Just gently giving the fingers and the toes and the feet and the body just a bit of a gentle awakening. And if you've been lying down, just taking extra care when you choose to stand up. And that was the very quick, very brief body scan practice.